Have you had clients come to you for back and pelvic pain during pregnancy? Did they have any prior injuries or experience trauma during a previous birth? In today's episode, I share a case study about a client who was suffering from low back pain during her second pregnancy.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody, and welcome to this episode. Today, I want to share a case study with you that I found was very, very interesting. But before I jump into that, I just want to put out a reminder that our holistic treatment of the postpartum body online cohort, the very first one I've ever run, is happening the end of September. The doors will open mid-September, so please put that on your radar, put it on your calendar to make sure that you check that out if you've ever been interested in taking the postpartum body course. This is a great way to have extra support as you go through the program. And if you have already purchased the online course but have not started it, please reach out to us at support@instituteforbirthhealing.com and we can put you in the cohort so that you can get that extra support, give you some deadlines to get things done by, have a little bit of accountability or a lot to help you to complete that course. So I am all about wanting to get this information into your hands. So I love when you purchase a course, but I love it even more when you actually complete it and start using this material in your practice. It is so impactful. You get much better results when you do this work. So I would like to share with you today about a case study. I just saw this person on Monday in the clinic, and she is 39 or 29 weeks pregnant with her second child. And she has a history of low back pain that happened in childhood or in high school, maybe when she collided in with two people in soccer and her body got twisted, and she was diagnosed with herniated discs at 2 levels. She was thinking it was like L4-5, but when I was working her, it seemed a little bit higher than that from what I could tell in her body. She didn't report any numbness, tingling going down her legs, only into her glutes. So that kind of had me questioning whether it's actually truly a disc or might it just be some SI joint issue. So she has a 3-year-old currently with number one. She had a vaginal birth with them, and she had some SIJ pain during the pregnancy, but it definitely got worse after the birth of her first baby. Her sacroiliac joints feel very tender. The birth of that first child was, the baby was late, so they induced her. She got stuck at 5 centimeters and got an epidural. She did 2.5 to 3 hours of pushing. She had some tearing. And afterwards, she was reporting that hinging forward, trying to lift the baby up out of the crib or changing table, all that was super, super painful. And she reported that she was really stiff in the morning and whenever she's stationary. She is complaining today currently of she doesn't feel like her hamstrings can turn on. And uh, she has some throbbing and feeling of swelling after she has intercourse, and her vaginal area feels like it's falling out with bowel movements. So a lot going on in vaginally and in her pelvis, low back area. And so what was super interesting was when I started my session off with her, I always start with a general listening, and I put my hands on her shoulders and I noticed that she had a twist going on in her posture. And so I asked her, I'm like, have you been diagnosed with scoliosis? She's like, no. And I'm like, okay. And her right shoulders were rotated back. But when I put my hands on her shoulders, I was listening into the tissues to see what the tissues wanted to do, to see if there was any energetic pull or going into the twist. And her shoulders, I didn't feel anything. So I brought my hands down to her diaphragm, lower rib cage area, and that's when I felt the energetic pull. It was happening at the level of her diaphragm. And so I just made note of that. And as I felt that twist, when I tuned into or just put some, um, I touched in at the lumbar spine. To me, it felt like it was more 2, 3, maybe or 2, 3, 4 area was felt really harder and decreased mobility. In standing, it just kind of popped into my hands more, that area. But when I inhibited that L2 through 4, the rotation went away. So I knew that this rotation, or I'm assuming that this rotation in her diaphragm is definitely connected to her injury in that lumbar spine. So I laid her down and lifted up her legs, and there was a slight twist happening with her legs. And I immediately went to her diaphragm and worked on releasing her diaphragm, and that twist was very prominent in there. And so I kept one hand posterior. I was trying to just release the diaphragm, but I really wasn't getting anywhere. So I took one hand off and put my fingers. She's supine at this point. My posterior hand was on the posterior rib cage diaphragm area, and then I just put my fingers on that lumbar. I guess I would say L2, 3, or 3 and 4 is where I was at, and they were just super hard, and they just felt different than L1 and L5. And so I just kind of compressed up gently on that, and then I could feel this release happening and this unwinding happening between these two structures. And then I went back to the diaphragm and released a little bit more in the diaphragm, and then gave the lumbar spine a little bit more attention. And then I came underneath and felt the sacrum, and the sacrum was definitely in flexion. It had decreased mobility at L3, 4 anteriorly. And I worked on releasing the sacral flexion in there. And I'm trying to remember, I'm going to look at my notes here, that um, sacrum, diaphragm, two sacrum. Okay, no, I believe the sacrum was pretty even in there. It wasn't off to one side, so it wasn't in that common birth pattern, but just more in plain sacral flexion. Um, Being 29, so then I addressed her pelvis. Oh, and then I closed up ischiomilium, rebalanced those two bones, and brought those back together. I think I actually had to have her do the uh exercise to use her adductors and abductors to help bring the bones back together again. That just really helped things out, made less work for me to do. Taught her how to do that, to continue that on at home. And then felt like her pelvis felt a little bit more in its appropriate positioning and movement. The ischium iliums definitely had, and PSISs. Her PSISs were definitely hard. And so adjust all that, got more mobility in those. And then I moved to her uterus, and all of her right side uterine ligaments were tight. The broad ligament, uterus sacral ligament, round ligament. So I worked on that. And then internally, her left side pelvic floor muscles were weak. Her right coccygeus was tight. And so I worked on releasing those pelvic bones, the pelvic floor muscles, using the pelvic bones. And she had a beautiful, strong contraction afterwards. And so then we went to work on lengthening for pushing during pregnancy or during labor, and she wasn't able to do it in supine. So we worked in side lying, hands and knees, tall kneeling. She really got it. And then we brought it back down into supine, and she definitely had a much better ability to lengthen her pelvic floor in that way. And when she got off the table, she was shocked to be able to bend over and straighten, and her back wasn't hurting her. And she just felt so, so much better. So even our pregnant clients who come to us in subsequent pregnancies, we still got to be looking at their pelvis and help their bones get that normal mobility back to midline, get them out of sacral flexion, and just help their bones settle into a more um, stable position so that they can function, they can bend and extend and not have any issues with their babies. So what I loved about this case is that she did have that previous injury in her, like the rotation of the diaphragm and the injury at L2, 3, 4 was definitely from that soccer injury, and listening at her diaphragm and feeling that twist, feeling that motion, and actually listening for the sacrum. The sacrum was still lifting backwards. Ischium iliums were splaying apart just a little bit, but sacrum was definitely lifting backwards. So all those things, learning how to listen, learning how to listen to see if the bones are still energetically opening for birth, are all taught in my holistic treatment of the postpartum body course. So if you're interested in learning more about how to do that, please consider joining me for that cohort happening. And if you're interested in doing a live course because you're like, oh, I learn better live, know that the completion of the online course is part of the coursework. It's the prerequisite for coming to a live course. So if online learning is not your forte, doing it in this cohort and having the support and the accountability to get you through the material is super helpful. So if you're planning on attending any live postpartum course next year, please sign up for the cohort now and get the support through the cohort to complete that online coursework so that you're ready to go once the live course becomes available or the time comes for that live course. Okay. So I hope this case study was helpful. Really listening to the body and seeing what you're sensing in the body is key for knowing where to go and what to do, and paying attention to their story and understanding that, 2.5, 3 hours of pushing is a long time to be pushing. That pelvis definitely can get stuck in that open birthing pattern. And helping to bring those bones back together really does help the function of the low back and help them feel more stable and secure in their bodies. So I would love for you to learn this if you have not already. And for those of you that have already taken my courses, please help me spread the word. Tell other practitioners to take these courses so that we can truly get moms getting and feeling better after their births. All right. Thanks everybody for listening in, and I will see you on the next episode. Here is to smoother births and faster recoveries. Take care, everybody. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.